You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. We're talking about extreme smile makeovers today. In fact, we've had him on the show. It's Dr. Rudy Wassenaar. And in fact, they say Rudy is the guy. He's BC's go-to implant dentist, Dr. Rudy Wassenaar. Welcome back to the program.
Great to be back, Randy. Yeah.
Now, you brought a stack of photos, but for people that don't know you, like who's the typical dental implant patient?
If I had to categorize them, I'd say there's two types of people, really. One that is afraid of losing their teeth, and they have maybe bleeding gums, or they can't chew properly, or bad breath, or maybe they lost some already and they don't like the way that feels or looks like. And the other one would...
So they feel like they're going to end up in a denture. That's why they go to you to get new teeth.
Yeah. They don't want a denture, they want new teeth, and then they come and see me and try to figure out what are my options.
Okay.
Yeah.
Now, the denture wares, are there a lot of them in Canada? I mean, here in the States, we think of Canada as such a healthy place, but are there a lot of people wearing like a denture they don't like?
You know, I've been a dentist for over 40 years. I can tell you that most people, if they could do it over again, they would not lose their teeth and they would have kept their natural teeth and not have dentures. So yes, the problem with denture wearers is that they don't like where it's going, and they're looking for solutions. Yeah.
Now, is this, correct me if I'm wrong, that for the denture wear, you can actually put like 2 or 4 or 6 implants on the lower and give them a full set of teeth, same as the upper, that don't come out. So on the day of the procedure, they could walk in with no teeth and walk out with upper and lower teeth that don't come out.
That's correct. We can do that now. Yeah.
Okay. And you pretty much have the system where you do it all right there. What does that mean?
What it means is that we take the whole process and have it offered under one roof. So we do the diagnostics, we figure out the treatment plan, and we do the surgery. We design the teeth, we put the teeth in place, we monitor the healing, and look after our patients long term. One-stop shop.
Now, correct me if I'm wrong, because the way it's done over here, I think is the way it's done in Canada, which is you go to one doctor that does the surgery, you go to another doctor that puts the teeth on top, and then get them maintained elsewhere. So you do all 3 parts.
That's right.
Is that why you do it so quickly?
Well, yeah. You know, if somebody has to go to another person for the surgery, and then third party for maybe the teeth that go on there, and then another party to do some other things, by doing it all in-house, having only one person to deal with, it just much better. Yeah.
Now we should mention in BC that a patient on a video, on a commercial that kind of went viral in a way.
Yeah, I did. Yeah.
That she said after you fixed her teeth, gave her brand new teeth, she said, "Rudy is the guy."
Yeah.
And now that's like the slogan they say about you.
Yeah, that's my tagline to this day. Like her name is Joan. I did some work for her. She wanted certain things, and I gave her the smile that she always wanted. She can chew, she can function, play with her grandkids, and at the end of it all, she's very happy. And she said, he's my dentist, Rudy is the guy. And to this day, it sticks. Yeah.
Now, you're in the movie theater, so you go to see a movie, and then there you are.
I'm the guy.
Rudy is the guy.
Yeah.
Now, you stopped playing that in the theaters, and they complained.
Yeah, I forgot to renew the subscription, and then so they dropped it. And then we started getting phone calls, and people say, "Hey, where's the ad? We don't see the ad anymore," because they're looking forward to seeing it.
It's kind of funny.
Yeah. Sometimes people actually will chant it.
Oh, they do.
Yeah.
I think you told me you were crossing a street one day.
Yeah. There's a patient of mine. I knew him for a long time, and he was there with his kids pointing at me. He said, Rudy is the guy. Yeah.
That's funny. Good for you.
Yeah, that's awesome.
And we should mention, because today we're talking about implant dentistry, and I know you do all types of things.
That's correct.
In fact, let's go through that list of services.
Yeah.
Because I guess what may take, and you wanted to make sure, I should mention this, that you're not negative about any of the specialists.
Oh, no, no.
Because you have great specialists.
No, no.
You said. But you're doing things that would take maybe 2 or 3 specialists. What does that mean?
Oh, what it means is that practicing in Williams Lake, it means people have to travel. They'll have to travel 400 or 500 kilometers to get and see another person, which means taking time off, paying higher expenses, and it just drags on the process. And
so like if you needed a root canal, you would go to the root canal person.
Yeah.
And you have some training in root canals?
I do, yeah.
Okay.
Yeah. But that's part of general dentistry. I do that routinely, and
Okay.
I do work with root canal specialists sometimes if it's a complex case, but not very often. Yeah.
And what about and things like gum disease or gum infection? You work with that as well.
Yeah, I work with that in my office as well, to the best of my ability. In some rare cases, I would get another specialist involved if the person needs that level of care. Yeah.
And you also, I guess you've adopted technology, so you actually have printers that make crowns right there in the office.
Yes, we do. We have the capability now to do a crown in one visit. So traditionally, we would do the prep work for a crown. We would then take an impression and then a temporary crown. The patient had to come back in 2 weeks and then have the crown put on. Right now, it's all in one visit. A lot of my patients come in from far away. They drive maybe 5-6 hours, and now, now by having a little longer appointment, they don't need a second appointment.
So dentistry has got much faster.
It's much better, much faster.
Less painful?
Less painful.
Because you're big on sedation, right?
Sedation is
Well, you're kind of known for sedation.
Yeah, we do a lot of sedation because a lot of people are apprehensive about getting the work done. And if we can somehow make it easier for them, take the edge off by doing some sedation, it just makes it that much more agreeable for them.
So they're all numbed up, obviously.
Obviously, yeah,
And
for
then,
sure.
so what levels of sedation do you offer?
We call it moderate sedation. So it's a combination of medication that they take ahead of time, and then we get laughing gas on top of that if we need it.
Okay.
Yeah.
And they enjoy the appointment. They supposedly love going to Dr. Rudy. Is that right?
Well, that's what I'm hearing. And the good thing about it is that while they're in the dental chair, they're doing just fine. And most of the time, they don't even remember much after it's all done.
Oh, is that right? Like
yeah, it goes by very quickly. We tell them after maybe working on them for 2 hours, and so we're done. So they say, oh, already? Yeah.
That's good. You know, look, I've had you on the program at least 2 times.
Yeah.
What's changed from the very first time, as far as implant dentistry? What's changed over the years? Like, why is it better now?
What has changed is that we are doing things a lot more accurately now. As a matter of fact, we just, for the last year or 2 or 3 almost, we got new technology where we can use artificial intelligence to help put the implants in exactly the right spot. And what it means is that it works a bit like a GPS. I get real-time feedback when I place the implants.
Like where to put the implant you have a video.
Yeah, I do have a video.
And I think we'll show that.
Can we play that?
Yeah, in a little while.
Okay,
But
great.
but now it's like I wouldn't call it a robot, but in a way it's artificial intelligence that's telling you where to put the implant.
Yeah, it's kind of funny how it went. There was an adjustment for me because as a dentist, I'm so used to, crawling right into where I'm working and look inside the patient's mouth. Now, I'm looking at the computer screen and look the other way
Is that right?
while I'm placing the implant because I can see a lot more on my computer screen, put the implant in, than before ever was possible.
So it's like a guided surgery.
That's correct.
Like the way the medical doctors are doing this in their surgery. They're looking at a screen rather than looking at where they're
Exactly, that's how we do it now.
working. But not a lot of people are doing it that way.
Surprisingly, no. And
less than 5%, you think?
Not even that. I think there's about 50 of those machines in Canada right now.
So it's not a lot of people doing it.
Not a lot of doing
What
that
if they
way.
took it away? We talked off camera about this. What if they said you can't use that anymore to do your implants?
I wouldn't quit. I would quit. I wouldn't do them anymore. Yeah, it's such a comfort in knowing that it's safe, it is accurate, and we're getting excellent results. Even my lab assessor, when he gets my cases to make the crowns there, and he has other dentists, maybe visiting his lab, and they see my cases always being perfect, and the ones who still doing it old style, they have to kind of compromise in certain times.
So old style, and I asked you about that.
Yeah.
So I guess how it's typically done is you might open up the gums. Yeah.
That's right.
Look for the bone with your eyes.
Yeah.
Correct me if I'm wrong.
Yeah,
on
no,
this.
you're right.
It almost sounds like an exaggeration.
Yeah.
Opening up the bone,
filling
around for bone, and then putting the implant based on like hand-eye coordination.
Hand-eye coordination, but the thing is we're sitting on an angle for the patient, like we're sitting not right on top of it. So our eyes kind of fooling us. We think it's going in straight. So I have a dental assistant looking from her angle to give me some help as to how...
That's how it's normally done.
Yeah, that's how it's normally done.
And then they have to stitch the gums back up.
Yeah.
Is that what causes a lot of the discomfort, is the stitching of the gums?
Pain and swelling. Yeah,
Okay.
yeah.
So now that's almost eliminated?
I hardly ever use stitches anymore. It's that accurate. It's amazing.
Is that right?
Yeah.
In fact, let's go to that video.
Sure, yeah.
Okay.
So there we are. You see this thing that looks like a QR code on my handpiece.
Yes.
And then you see my setup there, and there's the screen I'm looking at while I'm doing the implant placement. Now, on the left top of the screen, you see this bullseye. See, there it is.
Okay.
And then you see the drill that I'm using, and it helps me put it right there in the spot where it needs to be. And then very easily, very quickly, we get it all done. Like we said before we had to open up the gums and do it all like from different angles and trying to get it straight. This time it's straight every time. Usually when I place an implant, it's done in about 5 minutes. That's it.
Is that right?
We're done, yeah. No stitches needed.
Now, your buddies, you must have dental friends, right?
Sure.
And they don't have this.
They don't have it.
What do you tell them?
Why not? That's my question. Why don't you have it? I even talk to oral surgeons that supposedly do a lot more of those implants than maybe most general dentists would. And they all think, well, I'm kind of used to it the way it is, and it's working pretty good. You know, pretty good isn't always good enough, I think, you know, in my world at least. You know.
So if they took away that technology, it'd be tough for you to do it.
Yeah,
in the same precise way.
Yeah. It's like if somebody would take away your computer, you know, or your cell phone, how would your life be? Right? It's the same thing. This is such a important adjunct for what I do. It's so important to me that if I would have to give it up, I would quit doing implants.
Now, in the green room before we started, I asked, what's changed since last time you were here? And you were talking about your appreciation for what this can do for a patient. Could you elaborate on that?
It changes people's lives, you know, to have the comfort of knowing that they have teeth again, and they once again are able to function like they would, and it looks good, it feels comfortable, and they can stay away from the things their parents had, which was dentures, you know, and we can do things better, we can do it quicker, we can do it safer and more accurately. And it's a great time to be a dentist.
What do they like more? What they can eat, or what it looks like?
What's important to them? It's a number of things. It's how well they can eat. That's important. How it's going to look like. I've had patients come up to me and say, you know what? I'm here because my 4-year-old granddaughter sat on my lap and she looked at my teeth and she said, "Grandma, your teeth are ugly." And Grandma never realized that. Then she looks in the mirror and then says, well, maybe we should do something. And to be able to help people like that, to have the confidence, and you know, and then they find out that they can chew better, but it looks better too. And then they get more compliments, you know, they are happier. And the thing is, if you smile more yourself, the world will smile back at you more often.
Okay.
And I really believe that makes you a happier person and a more fulfilling life. I really believe in that, yeah.
And so what if you have bad gums? Okay, so somebody with gum disease, like the bleeding gums, bad breath, loose teeth, their teeth are shifting. Are their gums too bad to get this extreme smile makeover or new teeth supported by dental implants? I mean, I guess what I'm asking is, will the implants stay in there if you have bad gums?
You know, every case is different, but almost always, yes. Yeah, we can do something.
So that's kind of like the typical patient.
That's a typical patient.
They come in with bad gums.
Yeah, we have case after case where they come in and they sometimes teeth fall out on their own in some of my patients, and they say, okay, there's a tooth missing now. I say, I got a case they're going to show you later if I can. And to be able to make the pain go away, the bad breath go away, that they can chew again and they don't embarrass anymore with the way they look. And then there's your social life, your partner, your kids, like I said earlier, your grandkids, you know, all of that is part of life, your colleagues at work. And if you have the confidence where your teeth stay in and you're proud of it, everything seems to be just working better that way.
Now you brought a stack of photos. What are we looking at?
Yeah. Let me show this patient.
Okay.
So that tooth there, apparently it fell out on its own. He was chewing something and the tooth came out. And now we're looking in the mirror and that's what he had. Not just that tooth, but a lot of his teeth were in really rough shape. And he heard about our office and he drove in about 500-600 kilometers in to come and see us, and we could take care of him. He had infected gums, all kinds of things going on, and we built all that. And first we did his upper teeth, and he liked it so much. Then he says, "Okay, I need to do the lower teeth too." And he didn't waste a lot of time in going ahead because he says, "I'm not getting any younger."
Okay.
Yeah.
And so what? He got a combination of dental implants. What did he get?
What
did you do for him?
He got dental implants, and then we had teeth secured to those implants that would stay in fixed, just like natural teeth.
So
would.
upper and lower teeth that don't come out.
That don't come out.
So this guy would have been a denture candidate. I mean, he would have ended up in a denture possibly?
Yes, he would have ended up with dentures for sure, and then he would have been struggling with dentures because he had a lot of gum disease, which means that things kind of fall apart pretty quick, and then the dentures don't stay in properly.
And gum disease, is that an infection? Like if you had to define it, it's an infection in the mouth and bone?
Well, let me put it, it's a bit graphic, but let me explain it to you this way. When you look at somebody has severe gum disease, it's an infection as big as a tennis ball when you look at the surface area. So why wouldn't that have an effect on your general health? Of course it does.
Okay.
You know, it gives all kinds of things. You can't eat. Nutrition is a problem. Your immune system is under extra burden. If you are diabetic and you have gum disease, you know, it makes it more difficult to regulate your diabetes status. High blood pressure, heart health, it's all connected.
Because this infection creates like an immune response.
It sure does, yeah. It makes,
so you're able to clear that up?
It all goes away, and people come back and say, you know what, I feel so much better.
Really?
You know, there's no more of that pain and that uncertainty and that things that I had to manage with, and you can't eat this or you can't do that. It makes all the difference. If I hear anything that people regret about implants, is what they tell me is that, and you might not want to believe it, but that's my experience, is that, you know what, I wish I'd done it sooner. If I had any regret, I should have done it sooner.
Yeah, so when you say people hold on to their teeth too long, is it the fear of the dentist that keeps them from going into you, the associated with pain?
I think
What's your take after all these years?
I think it has a lot to do with that the average person doesn't really know what the options are.
Okay.
You know, they think to themselves, well, yeah, you know, maybe do this or maybe that, and then they heard about what they call posts, and so once we have a chance to have a good look at them and spend some time with them and figure it out, we quickly, you know, can get good results.
Let me see his after. Do you have a picture of him on the after?
And that picture was taken right in the dental chair. You know, he's still wearing his safety glasses, and he just couldn't stop grinning. Yeah.
Yeah. What's it like when they look at their mirror for the first time? Do they ever get choked up?
Yeah, they do. The first few moments they're quiet. They can't believe what they're seeing, and then they oh wow, and then when they realize that they can chew with it takes a bit of practice. You know, it's like buying new shoes. You know, they come back and say, you know what, this has changed, that has changed, I'm so happy. And then, you know, sometimes we do some minor adjustments to make it even better, to dial it in better. But in dentistry, of all the things I do, I would say this is the most life-changing procedure, you know, that I offer to my patients.
People say you've changed their life?
Yeah. Like I said earlier, you know, the grandmother having her 4-year-old on the lap, and then the granddaughter saying, okay, your teeth are ugly, this or that, or on and on and on. You know, if you can give them a nice smile and they feel young again and they feel vibrant again, and it just has an effect on everything in their lives.
When you see a consult, the guy can't eat or the woman cannot eat and chew, and they're kind of hopeless, meaning without hope, they don't know anything can be done. Yeah. Do you, in your mind, see the end result like you think, boy, they don't know how good this is going to be? Does that ever happen?
All the time. I can see somebody up, have a good look, and pretty much right away I can figure out, okay, this is the way to approach this case and get a nice result. Yeah, for sure. Yeah.
Now, you know, we were talking in the green room.
Yeah.
And we were talking about retiring, things like that. You said, and I'm paraphrasing you, but you could have retired a long time ago. You do this because you think, I think you said you think it's fun, or you like doing it.
Yeah, I don't need to work anymore. You know, I mean, I've done it for a long time. I've always been, you know, very active and successful, but I'm still doing this kind of work because it's really.
So you like love it?
Yeah, I love it. It's so interesting, and with the new technology coming out, sometimes I wish I was like 20 years younger.
Is that right?
And carry on like I have. Obviously that won't happen, but yeah, I'm still working in the field and enjoying it very much.
Yeah, but what about the patients that have been wearing a denture,
Yeah.
let's say 15, 20 years?
Yes.
Is it true that because after you're wearing a denture that long, you lose bone, you don't have enough bone to get new teeth supported by implants? True or not true?
Not true. No.
Okay.
We can always build bone back if we short some. We can do procedures and if and other things too. If you're older, let's say you're in your 80s and you got diabetes and maybe some heart disease, this or that, we can work with that. There's customizations.
So what if you're on? Because statistically,
Yeah.
if you're over 70, you're
Yeah.
on at least 4 to 6 medications.
Yeah. Yeah.
Can you be on osteoporosis medications or type 2 diabetes medications to get new teeth with implants?
Okay, osteoporosis medication is a challenge, but with diabetes, as long as the diabetic situation is well maintained and well regulated, it's no problem. Let me show you the next patient.
All right.
So, this is a very attractive and successful woman, and she didn't like the gaps between the teeth. And other things we noticed is that she really can't chew properly. She's missing some teeth here and there, and she was wondering what could we do. And we did a combination of some orthodontics to close the space. She was missing some teeth in the back. We put some implants in, and then on the left lower, she was missing a tooth. They put an implant in, and at the end of it all, she ended up with a beautiful smile. That's
And like you said, the teeth look real.
Yeah.
I mean, they look authentic.
Yeah.
So who's doing that?
Well, I'm lucky. I'm working with an artist as my dental lab technician. He's got that flair. He's got that intuitive sense of what looks good and what works well and does beautiful work, and that's why it ended up the way it ended up. And yeah, it's very rewarding to do cases like this.
Very nice. And time for a few more photos.
Okay. Here's another case.
Okay.
It's a middle-aged lady. She came in and she decided to have her teeth looked at, and obviously there's a few things that we addressed. So
Like, what didn't she like?
she didn't like any of it. Her teeth were spaced. There was discoloration. She had some teeth missing. She was about to lose some teeth and didn't want to lose any more. And she came in with a specific request. I don't want dentures and I want it fixed properly. So we ended up a combination of different things. We did some crowns, we did some implants. Yeah, she needs some root canals. And then
All at your place.
all at my place.
Okay.
Yeah. Let me show you after.
Okay. Very nice.
Yeah. So it changed her life. It changed everything she does. And I did this case a long time ago. And I think it's about 20 years now. It's still fine today. Yeah.
Is that right?
Yeah. And it's nice to see that last that long. And it gives me confidence in making the recommendation to more of my patients.
Now, you've traveled, I was looking at your bio. I mean, you've
Yeah.
traveled all over the United States, all over Canada,
Yeah.
to learn even just how the teeth come together so that way it lasts longer. Is that one of the benefits there with your training?
Yeah, the interesting thing is when you look at teeth, if teeth work better, if the bite's okay and everything lined up, they look better too because everything fits in better. The patient adjusts to it easier and quicker. And yeah, I had to travel and spend a lot of time to learn those skills. The knowledge is out there, but it takes an extra effort to
So
go
the kind
through
of
that.
stuff we're talking about today,
Yeah.
these extreme smile makeovers using dental implants or
Yeah.
giving them new teeth, they didn't teach you that in dental school. This is what you learn afterwards? Is that correct?
Not at all. They don't teach any of that in dental school. Like when somebody comes out of dental school, it's like you getting your driver's license. You get your license to drive a car, but you still can't drive.
We're talking about general dentists.
Yeah, general
Right,
dentist.
okay.
Yeah. So it takes a while to get to a level, and you need to show the interest and the willingness to pursue those extra skills. And when I came to Williams Lake, my current market, early on, I realized that this place is remote, and I need to learn some of those specialist skills to help my
Okay.
patients better. And that's exactly what I did. And it took a lot of effort and a lot of time to get there. It's a process.
Are you a perfectionist? Did they ever call you that?
Yeah. I'm afraid I'm a perfectionist. usually I'm not happy, about something, and I try to make it better. Yeah.
That's good. Time for a few more photos.
Sure. Randy,
Okay.
you just said it's just teeth, and some people say that, but look at this case where you arguably.
Well, she has a pretty good looking smile. I mean,
Yes.
a great smile, as a matter of fact.
Yeah. But what she didn't like was that her teeth were a little worn, and if teeth are worn and flat, then you look older.
Okay.
And she didn't like that. So when I first met her and I had a good look at it, and I thought, hey, I can do something there. I can make it really pop. And so we had some more discussions, and we talked about it and started working on it. And
What did you do?
I did a combination of crowns and veneers.
Let's take a look.
Yeah. There you go.
Well, you're right. It does make a big difference.
Yeah. So you can see how that changes a person's outlook and
She's
how
more attractive.
Yeah.
But you say just teeth. It's not just her. Teeth make people look more attractive.
Teeth
At any
make,
age.
Yeah, teeth make. Most people would say that the first they look at somebody's face, they look at the teeth.
Okay.
If the teeth are taken care of, then you look healthier, you look more vibrant, you look smarter, you look more intelligent, more successful, and that becomes part of who you are and how you conduct yourself. That's why it has such an important aspect of general health and well-being.
So people with bad teeth are judged. Do they ever tell you that?
Yeah.
Like they think they're not clean, or they think
Yeah,
they're...
you know what? The sad thing is that sometimes you have bad teeth and you're a little bit withdrawn, but you still have a story to tell. You still have something to contribute to life, and sometimes you don't get a chance to tell that story. And improving the smile sometimes will unlock that. And people make new friends.
Really?
They get new
because
jobs.
their confidence is better?
It's the confidence.
Like more charisma?
They just feel better about themselves, and they act accordingly. Yeah.
All right. Well, Rudy is the guy.
Oh, thank you.
That's what they say about
Yeah.
you in BC. Final message. Somebody
Yes.
watching this, they don't like their teeth. Maybe they're worried about ending up in a denture. They don't want a denture, a traditional denture. They've heard what you have to say, but they're still scared for whatever reason. They don't want to go through the pain, or they're worried about expense. What do you say to them?
Well, what people are scared of is usually the unknown. They're scared of things they don't understand, and then you tend to wait, see what happens. What I would suggest is just come in, get the information, let us have a good look at you and
Like know your options.
Give you some options. Yeah.
Okay. And what's the best way to make an appointment? Do they go online and do it, or just call your office?
Best way is to make a call and explain what your requests are and what the issues are that you need help with, and we'll get you in for a consultation, and we'll
Do they
go
get
from
to
there.
see you? Do you meet all the patients? Because I know you have other doctors that work there.
Yeah.
The legend,
Yeah.
doctor.
Yeah.
No, I know you're a humble guy. I was
they'll get to see
being
me.
facetious there, but I want to thank you for coming on the show. Always a pleasure to have you on the program.
Likewise, good to be back.
Thanks. You've been watching the
Yeah.
Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.